I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Yeah, this is Calvin Pierce from Clinical Psychiatry News. It's a little low.
Take it out of the board.
Yeah, I'm interested too in the panel's statement about the long and the short-term efficacy of the treatment. We've seen a lot of statements in recent years about cardiovascular disease and cancer treatments where decisions have been made about treatment alternatives based on 5, 10, even 20-year recurrence rates, and sometimes very small differences. And I'm wondering how the panel could explain to the general public how it's able to make the recommendations it has on the basis of only 4-week duration follow-up studies.
Would someone like to try to answer the 4-week question as Devil asked about this? Not a 4-week follow-up. Come on, okay?
Well, is this on?
Yeah.
I think most depression is a recurring illness, and so that you treat each episode, and I think the efficacy then is the treatment of the acute episode. It's sort of like giving penicillin for a strep throat. One would not expect it to prevent strep throat 6 months hence.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and might make copies available for the panel. We're talking about having at least accurate information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device, and in there it shows the physical characteristics. The other, and pardon me for the emotional content of it, I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. Now that's emotional. I don't really want to bring that up. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth and length and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1-pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that's almost instantaneous entering the brain. This takes a half a second. Now that is just pure factor data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gum. Out with your gum. Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
A little dab will do you. Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it. That's right. Just bite down. Now bite down on it.
good. Are you ready?
Ready.